Good afternoon, ladies and gentlemen. This is Dr. Ravi Shankar, Senior Endocrinologist at Apollo Hospital, Jubilee Hills. Here I am to communicate with you about diabetes in the context of the current lockdown and the current COVID-19 situation. We all know that we are in a different times compared to what we were in the past, and this will continue for the next 6 months to 1 year at least. So it is pertinent to remember that we do take care of ourselves, especially if we do have diabetes mellitus. As we all know, diabetes is a lifestyle disease. And this COVID-19, the novel coronavirus, they have affected our lifestyle. The way we live, the way we go out, the way we do exercise, the way we entertain ourselves. So in order to deal with both COVID-19 as well as diabetes, we need to make a lot of adjustments in our day-to-day lifestyles. Be it exercising, be it eating food, be it communicating with our doctors, or taking care of our blood sugar readings, and also enabling our families to stay safe. So in this context, let me start with exercise to begin with, because we all know that exercise is one of the very important areas that we need to address if one has diabetes mellitus. If you look at the various aspects that are very important in any diabetic, to begin with, it would be the foods that the diabetic eats. Next comes exercise, and last but not the least is the medications that the person takes along with the tests that the person does. So let me start with exercise and the ways that we can change ourselves, adapt ourselves, and adopt ourselves in order to ensure that our blood glucose levels are under good control in these testing times. We all are used to going to gyms or going to parks or walking on the streets early in the mornings in order to get our exercise. But unfortunately, we can't do that now, because if you go to a gym, there's a risk that we might contract infection because we touch the surfaces there and the equipment there. And similarly, some of us are very fearful about going for walks into the parks because A, there is lockdown for a good reason, and two, because we are all fearful about wearing a mask and going out, because we are really risking ourselves and the public as well. So, does it mean that we need to stop exercising? The answer is definitely not. We need to exercise, but in different environments. It could be our home. If it were to be a gated community where you live, and if you have decent streets and walking spaces wherein you can maintain social distancing but yet do some exercise, then that's a good way to start. Even within one's own home, one can do a lot of exercises. For instance, remember the good old yoga, which our Indians are very much used to. But if you are not used to doing yoga, it's a good time to start. There are many apps, there are many videos in the internet. You can ask your friends as well. They can share with you, and you can start doing yoga. Similarly, one can do a lot of aerobic exercises, be it jogging, brisk walking, skipping, using a treadmill if they have this facility at home, and ensure that they get their right dose of exercise daily. Not to forget the fact that one can also do light weights at the comfort of one's own home, and also making sure that one takes care of their abs, do crunches, so on and so forth. If it were to be a family alone, and if you have a decent place where you live, you can even play games like shuttle or table tennis. There's no reason why you can't avail if you have these facilities within the vicinity of your home without going out, risking yourselves and that of the public. Do remember, when you go out, you're supposed to wear a mask, right? So this is about exercise. And we all know that when we do exercise, we need to check our blood glucose readings before doing exercise. taking a healthy snack before you start exercise. These are very important precautions to prevent hypoglycemia. Moving on from exercise, because we have only about half an hour, I don't want to get stuck with exercise alone. Let's move on to weight management aspect. Most of us over the last 50 days or so have been in our own homes and not coming out. If you have diabetes and if you were to stay at home, that means without your knowledge, you are not burning calories. That means there is a high risk that you would pile on pounds as time goes by. So what can you do? You can still ensure that your weight is taken care of by ensuring that, I repeat it, you can still take care of your weight by ensuring that you exercise regularly, which we already discussed, religiously, and also watch the type of food that you're eating and the quantity of food that you're eating. It's not just the type of food that you are eating that matters, it's also the quantity that matters. Because even if you eat the right kind of food, say you're eating quinoa daily, or if you're eating only a millet-based diet, but if you're still eating too much of this, despite the fact that it is a healthy diet, if you eat too much of it, obviously your blood sugar levels won't be under control. Obviously your weight would also be not under control. So one needs to watch what they are eating. One needs to exercise as well in order to make sure that the weight is under good control. Weight management is not as simple as what I described. I know that there are a lot of other factors as well. For instance, when we go out as part of our regular non-COVID lifestyle, for instance, going to a mall or going to our own offices, so on and so forth, we, without our knowledge, do spend a lot of calories. These amount to good, I would say some 700, 800 calories at least daily. And these calories are not being spent. We're all saving these calories because we're not going out, if we are not going out. Hence the reason why we need to be extra cautious if we are working from home or if we are actually not burning the calories which we would normally have otherwise burned. I know there are questions coming there. For example, somebody asked what are the common risk factors for hypoglycemia during Ramadan fasting. I will try to touch base on that. So next comes glucose monitoring at home. Many people keep wondering as to how they can take care of their diabetes and their blood glucose levels when they are at home. There are various means by which we can check our blood glucose whilst at the comfort of our own home. To begin with, we have the simple good old glucometer. A glucometer is a small device, as most of you know, which can be used to check the blood glucometer readings periodically, regularly, as it might be required. One might check the blood glucose readings fasting, post-breakfast, pre-lunch, post-lunch, pre-dinner, post-dinner, bedtime, and also on their own account if they think that they might be having a hypoglycemic episode, that means a low blood glucose reading, or even if they are not feeling well, in order to just check to ensure that the blood glucose readings are not terribly high or terribly low. So glucometer is a very simple device that can be utilized at the comfort of our own home and give us invaluable information about our own blood glucose readings. Apart from this, we do have CGMs, continuous glucose monitoring systems, which are also called, which are marketed by various brands and which can be a small patch that we put here and which can record and trace our blood glucose readings every 5 to 15 minutes and give us a track. Some of them can even give a real-time tracking of your blood glucose readings. Then there are these insulin pumps which are matched and married with these continuous glucose monitoring systems, which can give invaluable information about how our blood glucose is going on as well. Some even have beeps and sensors which can even give us a warning when the blood glucose reading is dropping below a certain level. So we do have technology at our disposal which can help us to check our blood glucose readings, and it is very essential to ensure that we do check these, especially if you are concerned that the blood glucose readings might be dropping or going up for any reason. Yeah, somebody is asking another question: are dates safe to consume for diabetics? I'll address that along with the Ramadan thing. So this is about glucose monitoring at home. But do remember, one needs to have HbA1c around 7% roughly. Obviously, this has to be subjectivized and individualized. I can't give a blanket answer HbA1c value for everyone, but in general, suffice to say that we can aim for HbA1c of around 7.5 depending on the individual comorbidities, the individual's creatinine, the individual's liver enzymes, the individual's medication, the individual's duration of diabetes, the age of the individual, so on and so forth. Another question there: doctor, during fasting to avoid dehydration, what precautions should a diabetic patient take care? Yeah, I'll come to it. So this is about blood glucose monitoring at home. But if you haven't had a HbA1c blood test recently, it is time for you to go out safely, following all the basic precautions such as wearing a mask, maintaining social distance. When I say social distance, at least 6 feet distance. Remember, 2 meters or 6 feet. And ensuring that you wash your hands frequently, at least for 20 seconds with soap and water, or at least use alcohol-based sanitizers. And also maintaining cough etiquette, not to spit on the streets or on the roads. Remember, these are the basic precautions that are going to save us from contracting the dreaded COVID-19 and also to prevent the spread of COVID to others as well. So coming back to the questions that we have been asked, I know Ramadan is a topic in itself, but it is very important that people with diabetes who want to fast during Ramadan, in fact, check with their doctor before they fast. I know we are almost mid-Ramadan now, and if you haven't done that, it is time to do that. Because some should not be fasting during Ramadan for medical reasons. For instance, if they've got kidney problems, liver problems, significant heart problems, or if they're pregnant, or if they've got uncontrolled blood glucose, erratic blood glucose control with very big fluctuations in their blood glucose readings, or if they're at high risk of developing low blood glucose readings, then they shouldn't be fasting. And this is purely for medical reasons. And as far as I understand, that even the religious texts do exempt people who do have such problems to not fast during Ramadan. So please do discuss with your doctor if you're safe to fast, if you haven't already done. Please ensure that your blood glucose readings are being monitored periodically, for instance, using the glucometer that we discussed already. Please ensure that you're not having low blood glucose readings during this Ramadan time. Please ensure that you hydrate yourself by drinking adequate amount of water before the Ramadan fast and at the end of the fast. Make sure that you don't overly feast after the Ramadan fast is over in the evening, because if you were to overindulge in foods after the fast is broken, then there is every chance that you will pile on kilos, which is not good and which can result in not just problems during Ramadan but also after Ramadan because of something called insulin resistance, which means that your medications might not work and you may need higher medications and also higher insulin doses. And we all know that apart from this, higher body weight in itself can have other problems in itself. So please ensure that you do take care of what you're eating after the Ramadan fast. And in this context, we also have the question of the dates. Remember, anything which is sweet or which is sugary or which is dipped in sugar syrups shouldn't be eaten. So if you eat dry grapes, that's fine, but if you eat the plum, really juicy ones, then please ensure that you don't overdo and just have one date. If you were to have more than one date, then there's a problem that your blood glucose readings can go high, especially if they are the sweet ones. So common sense should come first. Be careful about what you're eating. Be watchful about your weight. Make sure that you don't get dehydrated. Make sure that you don't get hypoglycemic episodes, that means low blood glucose episodes during the fast. Make sure that your medications are adjusted. For example, some of the medications like SGLT2 inhibitors might have to be stopped if you're fasting. Make sure that some of the sulfonylureas that you are taking are definitely safe if you're fasting. Make sure that the insulin regime that you are on is definitely safe if you're fasting. So this is about fasting and your diabetes management during the Ramadan period in a few minutes. I know it's a topic in itself. Somebody asked me how to prevent hypoglycemia, low blood glucose. Low blood glucose is defined as blood glucose reading less than 70 milligrams per deciliter. If a person were to be taking more medications than required, or if a person were to be not taking food at the right time, or if the person is eating lesser food than regular food, then the person is putting himself or herself to increased risk of having a low blood glucose reading, which means the individual can be putting himself or herself to risk of not just having the symptoms of low blood glucose, which is dizziness, fuzziness, confusion, tremor, anxiety, so on and so forth, but also other complications such as heart attacks, irregular heart rhythms, brain strokes. Sometimes low blood glucose can also trigger fits or seizures. So do remember that you prevent low blood glucose at any cost, and ensure that you take your food on time. Don't self-adjust your medications. Don't increase your medications on your own unless you've been advised by a doctor. Also, make sure that you have the right knowledge as to how you need to treat your low blood glucose reading if at all you were to have a low blood glucose reading. These are all very basic fundamental precautions that you need to follow in order to prevent hypoglycemia. Remember, the medications that we have to treat diabetes, almost all of them do cause low blood glucose in some form or the other. But some diabetes medications do have a lesser tendency to cause low blood glucose compared with the other blood glucose lowering medication. Hence, if possible, if cost is not an issue, one need to use only those medications which have a lower risk of causing low blood glucose readings, if at all possible. So do discuss with your doctor. So I know there are a lot of questions. I'll try to answer as many as possible. Can we do both yoga and aerobic exercise for diabetic support, or which one is best to follow for more calories burn? It's a good question, in fact. Most people spend all their time at the treadmill when you go to a gym. That's not a good way of exercising. I know every individual is different and every individual needs an individualized care plan. But in general, it is very important to balance between aerobic exercise, i.e. cardio, and also weight training. Weight training or resistance is also very important, especially for diabetics. Because if you have good muscle mass, it just not increases your tone and your stamina, but also your ability to handle your blood glucose. So it's very important to ensure that you do a bit of weight training and also a bit of cardio. So don't spend all your time. I'm not speaking about this current scenario wherein we don't go to the gym, but in general at the treadmill. So balance it between both resistance exercises, i.e. weight training, and making sure that you take care of your muscles as well as your cardio. Doctor, during fasting, can I continue with my exercise? We advise not to do exercise during the period of the fast and also a couple of hours before and after the fast. The reason being, A, common sense, you get dehydrated. B, you get exhausted because of heat exhaustion. 3, you can also have electrolyte loss from your body, which you can't replace because you're fasting. And do not forget the fact that your muscles do need some glucose, which you don't have in your body. And you are at risk of having a low blood glucose episode as well, which we call as hypoglycemic event. So do ensure that you do not ever exercise when you're fasting. These are what are the common side effects of SGLT2 inhibitors. SGLT2 inhibitors are wonderful medications. They not only control your blood glucose levels, but they do have beneficial effects on the heart, on the on the kidneys, and on your weight, on your cholesterol, blood pressure, so on and so forth in general. But having said that, every medication has its own set of side effects. SGLT2 inhibitors should not be used in somebody who's fasting. They should not be used in somebody who's got type 1 diabetes in the current scenario. They should not be used in somebody in lieu of insulin. They should not be used in somebody who's sick and admitted in the hospital, or sick and not admitted in the hospital. They should not also be used in the elderly, frail people. They should also be used when they're not fasting only, and if somebody is fasting, they shouldn't be on SGLT2 inhibitors. These are general principles, but you need to discuss with your doctor before you stop any medication or start any medication. How to improve immune power? It's a good question. Immune power is something which everybody is thinking of. It's not something which you can go buy off the shelf and say, look, I bought some immune power. No, it doesn't happen that way. The way to develop good immune power is to lead a healthy lifestyle, be it a diabetic or a non-diabetic. Very important to make sure that you eat well, you sleep well, you exercise well, stay away from alcohol as much as possible, but if you have to drink the minimum quantity, stay away from smoking, keep yourself stress-free as well. This is also very, very important. If you follow these basic rules of the game, then I'm sure you're going to maintain your immune power. Many people underestimate the importance of sleep. Sleep is one of the very, very important tools to ensure that we have the right amount of immunity, the right amount of good hormones, cut down the bad hormones in the body, and get some rest as well. Sleep does wonderful things to our body and mind, provided you sleep on time, wake up on time, and sleep for the right amount of time. This is called sleep discipline, sleep hygiene, so on and so forth. But in general, do ensure that you go to bed at, say, 10 o'clock or half 10 at night. Wake up early in the morning, sometime between 5 o'clock, 6 o'clock. Make sure that you get a decent 6 to 8 hours of good sleep. Don't sleep for prolonged periods in the afternoons. Siesta might be okay, but not longer than a siesta. And also do make sure that you maintain this discipline. It's very important to maintain this discipline. Discipline is the word here. Because if you say end up staying at till 2 o'clock due to work reasons, or watching telly, or checking your WhatsApp, then you're not doing yourself any good. So do make sure that you sleep on time and wake up on time. And this is the way to build your immunity, apart from eating the right foods, healthy balanced diet we call it, and exercising regularly. And of course, making sure that if you're a diabetic, ensure that your blood glucose levels are under good control as well. Somebody asked about, sir, how to improve testosterone level for patients having multiple disorders. It's a completely different question. I don't think I can answer it, but there is nothing like improving testosterone levels in a normal, healthy individual who doesn't have testosterone problems. So there is this myth that, testosterone needs to be improved, blah, blah, blah. There's a myth that has been actually prescribed very well in the internet. Unnecessarily medications are being prescribed by quacks, so on and so forth. Don't fall to all these superstitions and myths. Just be healthy, lead a healthy lifestyle. But if you have any medical problems, see a qualified doctor. In this instance, an endocrinologist might be able to help you if you think you have any testosterone related issues. And there's a question here, sir, in Ramadan time, what is the minimum consumption of water for younger diabetic? See, in general, our body needs about anywhere from 1.5 to 2.5 liters of water, depending on what are the foods that you're taking. This is assuming that you don't have any kidney problems, any heart problems and all that. So that's the amount that you need to take. The good old rule is drink to thirst. If you're thirsty, drink water. So if I were to be fasting, what I would do if I were you is drink at least few glasses of water early in the morning before you commence your fast. And after you finish your fast, drink again a few glasses of water to your thirst. Okay, make sure that you're passing adequate urine. I mean, that's a very oversimplified version of it, but it's very important. So coming to stress management, which I promised I would deal as part of this, let me tell you, we are all stressed to a certain extent. The fear of the uncertainty, the fear of what is happening around, the fear of how long this is going to continue, the fear of losing jobs, the fear of how to balance our lifestyle amidst all this, the fear of carrying out our daily work, be it office work or be it traveling from your office to home in a safe way, or carrying yourself at your office. For instance, I'm a doctor, I'm at work, I'm supposed to be wearing a mask, but as you know, because I'm doing a Facebook live and I can't do it, it's still with me here, don't worry. So this is what you need to be thinking of day in and day out. So what I'm trying to say is, we're all stressed in our own ways. The best way to relax is to ensure that you follow a disciplined lifestyle, and also to remember that most of the fears that we fear do not ever happen. Remember, 99% of the things that we fear the most would never ever occur to us. For example, we fear that, look, what if I lose my job? After all, you might not lose your job ever. So there's no point in actually fearing. But at the same time, it's important that you work on what you should be doing in order to keep your job intact or keep your living intact. So do some meditation. It does help. As I said, sleep helps. Sleep on time, sleep well. Don't stick yourself to social media all the time, listening to the news on the telly all the time. It's not important really. It's not a cricket score for you to see what the count of the corona cases is every minute and every hour. And just watch for about 15 minutes in the morning and 15 minutes in the evening, the essential news. You don't have to check the news portals every minute. Similarly, one doesn't have to keep on reading every WhatsApp message that one gets in WhatsApp, or for that matter even in Facebook. And you don't have to respond to it as well. So these are very simple but very important and pertinent precautions that one need to follow, especially in the current scenario. It's very important not to spread fake news. Do your bit to actually decrease the stress of the environment, of the society that you live in. So make sure that you do not fall prey to the false and fake news that are spreading day in and day out. Just listen to the authentic portals, watch the authentic portals, government portals as much as possible. That's where you get authentic news. So prepare yourself for the worst, but at the same time, don't get anxious is the important message here. Meditation does really help, so practice it. Exercise is another way to de-stress yourself. So think about that as well. And just to relax, don't stay till too late at night. That's not a way to relax. So don't compromise your sleep on the pretext of relaxing yourself with movies or web series till late night. That's also a very, very important precaution. And do remember, pursuing your own hobbies and spending time with your family and loved ones at the comfort of your own home can in fact de-stress you. So do remember, there are many ways to de-stress ourselves. Don't fall prey to the unnecessary anxiety and unnecessary doom and gloom talk that is going around. Look, we will go through this in a meticulous manner, come out of it in a very successful manner. Obviously, we're going to see some mortality and morbidity as well, but that's the reality. Stay safe. Make sure that you don't fall prey to all these rumors that are going around. And last but not the least aspect of today's talk, social distancing. I touched base on this already. Make sure that you maintain 6 feet distance. Make sure that you don't cough on others. Make sure that you wear a mask all the time when you're outside. Make sure that you manage your cough etiquette. Make sure that you use your elbow like this if ever you're having a cough or sneeze. Don't spit outside. And if you follow these basic precautions along with hand washing and also making sure that you use a hand sanitizer if you don't have access to soap and water to wash your hands sometimes, then I think you will keep yourself safe and your loved ones safe, and of course the society safe as well. So I think this is a very key aspect, especially if you're a diabetic. Do remember, diabetics are at high risk of developing the complications of the novel coronavirus. The chance of ending up on ventilators and the chance of even dying is higher, unfortunately, if one has poorly controlled diabetes and has the new coronavirus. So be careful, control your sugars. If you're an elderly gentleman or lady, make sure that you're even more careful, because the complication risk is higher in diabetics, overweight individuals, elderly, if they already have many cancers, if they are already immunocompromised, have any renal, that means kidney problems, or if they have any problems related to their liver, or if they have got cardiac issues. So these are in general the high risk factors that can push the risk of complications of the coronavirus to higher levels. So please make sure that you stay safe. If you're a diabetic, take control of your lifestyle. Make sure that you get your immunity not in the form of a pill that is sold over the counter, because it isn't, but in the form of leading a healthy lifestyle, sleeping on time, eating the right foods, not smoking, and cutting down or better stopping alcohol, and of course eating a balanced diet along with exercising regularly and religiously. So on this note, because I think we have almost come to our time, if there are any questions that I haven't answered, I will try to, I know that somebody asked me about thyroid. I know today is not the thyroid talk day. Some other day I would be able to definitely try to answer all those questions. Definitely I would do some other day. But today let me excuse myself from answering those thyroid questions or testosterone questions, because they're not actually pertinent to today's talk. But make sure that you take care of yourself and your loved ones and everyone. Thank you very much.